Bismillah ar-Rahman ar-Rahim. I am Dr. Duha Muhammad Gabriel, dermatologist and aesthetic medicine specialist. I will talk about ABC signs in dermatology. Starting with A signs in dermatology. Aspo-Hansen signs, or called blister spread sign. This sign refers to the ability to enlarge a blister in the direction of the periphery by applying mechanical pressure on the roof of the intact blister. This sign associated with intraepidermal acantholytic diseases like pemphigus. Auspice sign. As we see in this picture, there is a typical plaque psoriasis. Presents with dry, thin, silvery white scales. On removal of the scale by scraping or scratching, there is a red, glossy surface with point bleeding. And this occurs as a result of removal of overlying suprapapillary epithelium with subsequent rupture of dilated dermal capillaries. Antenna sign. As we see in this picture, this is keratosis pilaris. When examined in tangential position, some follicles are completely spared, while adjacent ones are grossly blocked, showing a long strand of keratin protruding. Albright's dimpling sign. This sign refers to dimpling over the canuckles, enhanced by clenching of the fist. It results from underdeveloped metacarpal heads in Albright's hereditary osteodystrophy syndrome. Albright sign is also used to refer to the short force metacarpal digits observed in nevoid basal cell carcinoma syndrome. B signs in dermatology. Butterfly sign. This sign of skin lesion and of sparing site. Butterfly sign clinically, first picture, erythema over the malar eminence and a nasal bridge, and this is described in lupus erythematosus. In the second picture, there is a sparing lesion. Here this sign present in conditions with severe generalized pruritus as prurigo nodularis. Sparing sign over the upper central back. This site corresponds to the zone that is difficult to reach by hands. Barnett's sign. As we see in this picture, it is ridging and tightening of the skin of the neck on extending the head with visible and palpable tight band over platysma in the hyperextended neck, and this sign seen in scleroderma. Blue dot sign. As we see in this picture, there is a blue or black nodule is visible under the skin on the superior aspect of the testis or epididymis. The area is also usually quite tender, and this is clinically seen in the torsion of the testicular epididymis and appendages. Buttonhole sign. Buttonhole sign refers to cutaneous neurofibromas. As we see in these pictures, it indicates the ability to invaginate the tumor into the underlying dermal defect with digital pressure. Also, buttonhole sign present in syphilitic chancre. The buttonhole-like consistency is noted on the edge and the base of the ulcer on palpation. This sign may also be present in old pigmented nevi. Buschke-Ollendorff sign. This sign seen in secondary syphilis and cutaneous vasculitis. Here, this sign, there is deep dermal tenderness on pressing the lesion with a pinhead papular lesion of syphilis. Breakfast, lunch, dinner sign. As you see in this picture, it looks like plates: breakfast, lunch, and dinner. And this sign refers to the bites of bed bugs, Cymex lectiolaris. Usually follows a linear pathway in a group of 3 to 5 blood meals. See signs in dermatology. Cluster of jewels sign, or called string of pearls or rosette sign. This sign refers to an early stage of chronic bullous dermatosis of childhood, when new lesions appears at the margin of the older ones, resembling a cluster of jewels. Cornflake sign. Cornflake sign present in 2 diseases, curl disease and flagell disease, and refers here to the type of scales in these diseases. It takes the polygonal irregular configuration, and this is quite characteristic to these diseases. And the lesions appears over the lower extremities in curls and flagell disease. Krause sign. As you see in this picture, it is also known as axillary freckling, and this is seen in type 1 neurofibromatosis, where there is freckling occurs in the axilla, but may also be observed in other areas, such as perineum. Krause sign typically develops at a later stage than café au lait macules. Colon sign. As you see in this picture, there is a very umbilical bruising seen several days after subcutaneous intraperitoneal hemorrhage, and the cause is ruptured ectopic pregnancy, and acute pancreatitis occurs in about 5% of the cases. Coral bead sign. As we see in this picture, this is a papules seen around the nail fold, and this sign occurs in multicentric reticulohistiocytosis disease. Codability sign. This sign seen in alopecia areata, and it is normal looking hairs, tapered at the proximal end in the perilegional hair-bearing scalp, and it can be easily be made to kink when bent or pushed inward. Thank you so much. Don't forget to like, share, and follow other signs in dermatology. Dr. Duha Muhammad Gaber. Thank you so much.